I said, that wasn't going to get out of this world. He gets ahead.
Denise said that she said, I'm here, we can get started. So technically we're 4 minutes early, but we're just going to start and have some fun. Hi guys, welcome. I'm not doing my Rocky thing tonight. But you were born a champion, right? Turn to your neighbor and say, I was born a champion. Woohoo! Okay. So the deal is that I was working in my trailer and I was on my knees and I was trying to troubleshoot something and I got up and I couldn't walk. I'm like, oh my goodness. Oh, you know how that feels? Yeah. Somebody told me it's no good to get old. And I said, I don't know. Not my problem.
Get an adjustment.
Maybe I'll get adjusted. Take my own medicine. But it's once I get warmed up, not a problem. But I figured it's probably not a good idea to not create any extra impact, right, Paul? Yes. So tonight we got our thinking caps on, right, Farheen? Got our thinking caps on. We're here to learn and grow. When we stop learning, we stop growing. When we stop growing, we start what? Start dying. Yes. So, how many of you guys have been to a workshop before? Actually, raise your hand if it's your first time here. Raise your hand if it's your first workshop. JP. Yep. Yeah. Salone. Yeah. You too. Give them a big round of applause. Yeah. Nairobi. Yeah. Excellent. Merci beaucoup. So, how many of you now? I want you to watch this, guys. How many of you guys have been to 5 or more workshops? Hands up. Okay. Keep your hands up if you've been to 10 or more workshops. 20 or more. 30. 50. 75. 100. Okay. We stopped counting after 100. And many of these folks have been to the same workshop. Now, who in their right mind would be crazy enough to keep coming back to the same workshops? I would, and they would. Why? Because you can't get it all in one shot. It's like drinking from a fire hose, right? So every time you come back, even though it's the same topic, not only does the information change, like many of you guys have been to the diabetes workshop before, right, Luther? What you're going to learn tonight is different than what you learned even back in April. So there's updates, there's new things, even I have learned. So aside that, you can't get it all in one shot. So I want to encourage you to keep coming back. Make a commitment to be a lifelong learner. Because like we say, when you stop learning, you stop growing. When you think you're ripe, all you do is start to rot. Ouch. That doesn't sound as good, does it? All right. So set your sights on next month. We have our holiday health and stress survival. The holidays are the best of times, but for a lot of people with their health, they're the worst of times. There's more heart attacks during the holidays, more suicides. I don't want to sound morbid, but you really need to put your health in pole position, because if you don't, everything else around you is going to take it down a notch. And when you have some time, there's an interesting article that I put in there that states how the holidays knock 25 years off of your life. So when you get a chance, I want you to read it so that you can see what I'm talking about. So that's an important one. Next month coming up, keep an eye out for that. Going right into our diabetes workshop, I don't have to tell you, everybody here, you're here for a reason, because you don't want what comes down the pipe with diabetes. This is one of those diseases that you don't die from diabetes, you die from all the horrible atrocities that it causes with your health. And that goes from infections to blindness. It affects your blood vessels. And where do your blood vessels reach to? Some parts of your body or all? All parts. 60% of all the limb amputations are from diabetes, and the thing is, it's sneaky. It sneaks up on you. So tonight, I really want to take your focus off of what you really may have thought about diabetes related to something completely different. Cuts about 8.5 years off the lifespan of an average 50-year-old compared to a non-diabetic 50-year-old. And every person, if you're older and you have diabetes, your life expectancy is lowered as time goes on. So we want to live out all the years that God had intended for us. You don't know what His plan is on a day-to-day basis. We walk in faith, and we all sitting here, we all have a purpose in our lives, right or right? Yeah. And the body that you have, 1 Corinthians 6:20 says it's not your body, right? So you're a steward of this vessel that you walk through life in, which is temporary. It's temporal. And so we're called to be good stewards with our body, the physical part, because it affects the spiritual part. It affects the emotional part. It affects the mental part. When your health goes, it affects everything else, right? So when you start looking at your health like this, like, okay, well, I really need to start taking care of this. Like I take care of my car. Nobody in their right mind would neglect their car and not change the oil or get a check your brakes and this and that. You know you're heading for disaster. Unfortunately, many of us take better care of our cars than we take care of our bodies, right? So we need to have this concept and then wrap everything else that we learn around it tonight around that. We are flushing lots of money down the toilet when we do have to treat this particular condition. $200 to $500 a month on average, spending on medications to manage diabetes. It's 25% of all U.S. healthcare costs. And because of what you're going to see tonight, that makes it the most expensive health condition that we deal with as a country. Economically, it bankrupts many, many, many thousands of families every single year. Journal of the American Medical Association has shown and published this, that older patients with type 2 diabetes on medications to lower blood sugar levels may be, in fact, using these medications doing more harm than good. Now, this is not from Dr. Yachter. This is from the Journal of the American Medical Association. So the question I often ask is, what's worse, the treatment or the disease? What's worse? The treatment or the disease, right? And we always have to come back to that when you stand in front of a doctor and they hand you a prescription, knowing that, number one, is it going to correct the cause, and number two, how devastating are these side effects? So that's what we need to consider. Many people are not aware of it. Journal of the American Medical Association, again, another study, a review that included all the relevant trials, all the drug studies, all the current classes of drugs that are used, Januvia, metformin, Actos, all the different types of diabetes medications. They showed that none of the drugs reduced cardiovascular risk, disease, or other complications. In addition to that, we know that the most common medication that I see people on for diabetes is what? Metformin, yeah. So a lot of people like to play down metformin, that, you know, it doesn't really have side effects, but I want you to consider this, that metformin will actually control your blood sugar, but it doesn't correct the cause of the problem. And insulin resistance, the actual component of that, that's not addressed. So that part actually gets worse, and as time goes on, the disease may be managed, but really what's happening over time is the insulin resistance is getting worse, and as time goes on, the patient requires higher dosages of insulin, which actually perpetuates the cause of the problem even more. So you can't rob from Peter to pay Paul, right? So at some point, somebody who really is dealing with reality can see that this is not a long-term solution. Recently, metformin was recalled because of cancer-causing impurities in them. It also has a significant increase in risk of cardiovascular problems. It doubles your chance of dying from that. Again, all these things need to be considered. Insulin, another very popular approach to controlling diabetes. Where does it start? When somebody has high blood sugar, right? You go to the doctor, They see your blood sugar is high, and what do they want to do? Approach it with what? Medication. So they're going to give somebody insulin, right, to control the insulin resistance. But what does insulin do? Insulin is a hormone that actually causes fat storage. And the more weight you gain, the more insulin resistant you become, right? And the more insulin resistant you become, it actually causes more high blood sugar. So it's a self-perpetuating problem. So the worst thing that you can give to a diabetic is insulin. That's the fastest way to kill a diabetic. Insulin and risk of death from Cardiff University study showed that 53% elevated mortality risk. In this particular study, the main component of it was driven by the use of what? Insulin. Dutch database associated with high daily insulin doses showed 3 times the cardiovascular risk. In heart failure patients, insulin use is associated with more than 4 times the risk of death. Are you getting this, guys? If anybody in their right mind knew this who was taking insulin, what would they do? What would be the easiest thing? Show me the exit ramp. So what else can I do instead, right? Insulin and cancer. We had a patient here, somebody we know, love, and care about, and she was on insulin for the longest time. History of cancer, recently diagnosed with lung cancer, and still on insulin. Doctors still keeping her on insulin. Here's what it says. The UK General Practice Database showed insulin increased the risk of cancer by 42%, compared with a glucose-lowering drug that didn't raise insulin. Review of diabetics in the Saskatchewan population showed the use of insulin raised the risk of cancer by 90%. So, this is speaking loudly to us, right? So how do we measure this? How can we tell if we're moving in this direction? By which test? A1C. Everybody knows your A1C should be below 5.7, a little lower if you can do that. Every 1% increase in your A1C is associated with a 12 to 14% increased risk of death. Did you know that? So if you're at 6.7 or 7 or 8, here we go. 18% increased risk of cardiovascular events. 37% increased risk of eye disease or kidney disease. That's just a 1% jump, guys. Some of you in here, you're way past the 1% jump. And this should be a cause for concern. So let me ask you a question. What's the most important test to determine if you're trending towards Alzheimer's disease? Where's the relationship with this? Does anybody know? What's the most accurate blood test? They did a 6-year study in the Journal of the American Medical Association to find the most accurate way to predict whether or not an individual is moving toward Alzheimer's disease. You know what they found? A1C. What? A1C? What does that have to do with anything? Well, it's consistent with brain atrophy. When you run high glucose, high insulin, pre-diabetic, it's causing brain atrophy. Are you getting this, guys? So comparing the degree of brain tissue loss in those individuals with the lowest A1C, if it was around 4.5 to 5.2, they compared it to those with the highest A1C, 5.9 to 9.0. The brain loss in those individuals with the highest A1C was almost double. Okay, the higher the A1C, the more your brain is shrinking. Is that not motivation enough to get your blood sugar under control? If that's not, I don't know what is. I mean, we all want to know who we are, who our family members are. We don't want to forget things. I mean, one of the most challenging aspects of watching an individual's health degenerate is the brain. Give me anything but that. I'll do anything that I can to prevent that. Who's in agreement with that? Yes, this is so important. All you got to do is make sure you're looking for this. Look at your A1C. Look at your fasting blood sugar. Look at these things, and it'll tell you which direction you're trending in. All right. Now, many of us know we've heard of this insulin resistance thing. So let's talk about what's causing diabetes. What's causing insulin resistance? We've heard of this. Raise your hand if you heard of this lock and key phenomenon, right? So here's what it looks like. You have blood sugar. Your glucose goes up, so you got the sugar running through your bloodstream. So when glucose goes up, insulin, if your body's healthy, insulin will go up, and insulin is what goes into the insulin receptor and opens it up like a lock and key. And what that does is it signals the glucose channels to allow the glucose to get into the cell. Everybody with me? You remember that? Okay. So historically, what was believed was that the insulin receptors were being bombarded all day long by driving glucose, and they were just shut down. It was just too much. And so because of that, we weren't getting sugar into the cell. Well, with emerging scientific studies, we're starting to see things differently. Both, it turns out, are completely normal in type 2 diabetes. The insulin is normal, and the insulin receptors are normal. There's nothing wrong with the insulin receptors. That's not what's shutting down. If you look at the middle one right there, we know what normal is. If you look at the middle one, a malfunctioning insulin receptor would mean that we can't get glucose into the cell, right? What we're finding now is that's not the case. Actually, insulin resistance it's an overflow. There's too much glucose in the cell, and it's actually spilling out and spilling over. That's a little bit different, isn't it? Well, how is that possible? This thing called hyperinsulinemia. What does hyper mean? High insulin. Emia, a condition of an individual running high insulin all day long, right? For days, months, years, a condition that's developed, shoving glucose into the already stuffed cell. Glucose cannot enter the cell because it's already what? It's like trying to fit more clothes into your already overstuffed suitcase. When the glucose is left outside the cell, what happens? The body has to produce more insulin to force more glucose into the cell. As more and more glucose is forced inside the overstuffed cell, more force is required. So, the insulin resistance is the effect, but not the cause. The cause is the what? High blood sugar. High insulin. Okay, so the high insulin is a self-perpetuating phenomenon which is not traceable to the insulin receptor. It's actually the insulin itself. It's the hormone itself. And let me show you where this comes down to. So here's a little flow chart. We know what's going to start this whole cascade. Where does it come from? It starts with what? Fattening carbohydrates. Too much what? Too much sugar. Sugar, when sugar goes up, what else goes up? Insulin. So there's the primary cause. When you run that sugar, that insulin stays up all day long, all the time, and now is where the disease starts to develop. Here it goes. Starts something called fatty liver. Now this is starting to sound a little more serious, because here's what happens. The liver gets overfilled with glucose, because this is where it gets converted to glycogen, and this is where your energy gets stored. And it just gets overfilled, and then it can't accept any more glucose and starts becoming what? Insulin resistant. After it becomes insulin resistant and it can't handle any more glucose, now it starts converting to something called DNL. What is DNL? De novo lipogenesis. What does de novo mean? New. What does lipo mean? Fat. What does genesis mean? Making. Yeah. So now your liver is making new fat. The liver's making new fat all the time, and this is what begins the process and the disease of fatty liver. That fatty liver, guess what that causes? More insulin resistance. And then what does that cause? More high insulin. And what does that cause? More fatty liver. And what does that cause? More insulin resistance. And this is the component where it seems to be a little more concerning and more serious, because, again, it's not the insulin receptors that's really at the heart of this. It's the what? It's the liver. Yeah. Fructose insulin resistance connection. Fructose targets the liver like a guided missile. Fructose. When you hear the word fructose, what do you think of? Fruit, particularly fruit. It's even more strongly linked to obesity and diabetes, fructose, than glucose, and is more harmful because of the way it's metabolized. Every cell in your body can use glucose, but none of it can use fructose except the liver. Except the what? Liver. The liver. Why is this important? Fructose in alcohol is the only place where it can be metabolized and stored in the liver. This is important because when you overconsume fructose, it produces fatty liver. And insulin resistance directly, listen to this, you can start the process of diabetes and fatty liver without being overweight, without having high blood glucose or disturbing your insulin levels. If you're pounding away at the fructose. Fructose, you mean, does that mean fruit is bad for you? Well, let's stay with this theme where we're going here. Do I have your attention now? Okay, I'm going somewhere with this. Only 1 week of excess fructose can cause insulin resistance. 1 week, that's it. So the body can not store fructose directly. What happens is, once it's had enough to meet its energy needs, the liver metabolizes fructose into fat. And again, this is what gets into fatty liver, gallbladder disease. Virtually all ingested fructose is stored as newly created what? This excessive liver fat directly causes insulin resistance, as you saw on the flow chart. And the body can only handle small amounts of fructose. So here's my point. The dose makes the poison. The dose makes the poison. The food is not the poison, it's the what? It's the dose. So are fruits bad for you? No. It's how much fruit are you having? And what else are you having with fructose in it? So, fructose you have and glucose equal parts in high fructose corn syrup. What's high fructose corn syrup in? Some of our foods and drinks, or a lot of them. A lot of them, yeah. And so we need to look into this. So just with fruits alone, we can actually cause this lipogenesis to start in the liver if we're having too much of it. So again, it's the dose that makes the poison. We really need to look at our fruits and make sure that we're not just eating as much fruit as we want because we think it's healthy and we think that it has no effect on our blood sugar. Maybe it doesn't, but does it have an effect on the liver? Yes. And what happens? It starts metabolizing and creating fat and storing fat. So this is important. The highest fruits that you see here with the sugar are what? Dates, bananas. I can't see that word down there. I don't know those red fruits. Pomegranates, grapes, mangoes, cherries. Then you got blueberries, which are 12 grams of sugar per 100 grams. Then the lowest sugar fruits. What do we always say the lowest sugar fruits are? Berries, yeah. So we got kiwis at 9 grams, strawberries at 4.9, blackberries at 4.9, raspberries at 4.4. Then you have grapefruit is at 7. That's not too bad. Avocados 0.7. No sugar, almost no sugar at all. All right. So when you look at these again, all I want you to do is think about it. I'm not saying don't eat fruit, but what I am saying is the dose makes the poison. And that means that if you're having a big fruit salad and you're having a big container of fruit and you're not thinking twice of it because you think it's fruit and it's healthy, we're kidding ourselves now that you understand what's happening to the liver. Like a guided missile, right or right? Okay. All right, so now we're getting somewhere. We're making some good progress. Some of you have seen this before, but I just want to set the stage as far as where the next part is going to lead us.
asked me about, my diabetes diagnosis and, what did I do to deal with it. I felt as though, this is part of getting older. We heard these stories before. You get older, you're supposed to get some form of chronic disease. And there was almost a surrender until the vision loss. That was like a wake-up call and say, you know what, if I'm going to have to lose this war of health, it's not going to be without a battle. I went to my computer and Googled, reversing diabetes. And I was just hoping to get a glimpse in what's in the universe of slowing down the progression of how can I slow down my eye loss, how can I slow down the nerve damage, how do I slow it down? But when I started to see the R term used over and over again, reversal, and I started reading some of the stories, I said, you know what, something may be to this. And that is when I started the journey of saying, you know what, it's no more living with, it was about reversing, and I moved in that direction.
That's the direction we're going to move in right now. Before we do that, I just want to give special recognition to a few of our patients who are just knocking it out of the park. And I'm just going to take a brief moment and recognize them, and then we're going to go back to the presentation here. So would everybody recognize Deborah and Tamara, how wonderful they are? We love them. I was going to give you a special shout out. All right, so more shout outs to some people here who have been doing great with their care. First people that we want to recognize are for perfect adjustment attendance. Highly committed, never, ever miss an appointment, and getting phenomenal results. So we want to recognize Micheline, we want to recognize Linda, and we want to recognize Salon. I want you guys to stand up, and we're gonna crown you with a Medal of Honor. I got my man Salon over here. Yes. Good. Congratulations. Wonderful. Thank you. Okay, and then we have another one for 6 or more workshops under there somewhere. And this is our Core 4 University, Elevation Health Core 4 University degree this is a degree for 6 or more workshops. My man, Cap, stand up, give him a big round of applause. Yes, sir. Yeah, I think he's been to more than 6 workshops, honestly. He doesn't miss a workshop. Good man, thank you. Okay, and then we have a special award. This is a Lifesaver Award, and I want to invite up Michael and Emily Picarillo. Come on up, guys. Come on up. Yeah, Mike doesn't like to be put on the spot. Emily does, because she's looking sharp. Yes. Okay. So father, daughter, and dad. I think you were under care here first, right? And
well, Kim was.
Kim was, okay.
Yes.
And then you came in years later,
Years
doing better with your back. You said, hey, I got to get Emily in here. She's got something going on. And what was it? Arm numbness and headaches and neck pain, back pain, all that good stuff. But I don't think Mike really knew the transformation that was about to happen. I mean, he knew she needed help, but she really took the ball and ran. And what I want to do is I want to show you this picture right up there. That was Emily before, and she's lost 40 pounds. And obviously you can see her now. I want you to give them a big round of applause. And so this is the life saved, and that's the lifesaver. So historically and traditionally, we always give the Lifesaver Award. But I want to give you one of these also, because you've done a great job. I appreciate you. Keep up the good work. It's my pleasure. Best is yet to come. Love you guys. Yes, thank you. Wonderful. Love seeing that. Okay.
Wow.
Did I forget something? Oh, okay. Oh, thank you. What would I do without Deborah? What did I say in the beginning? It's no good to get old. Somebody told me that. Am I done? No, the other ones I'm going to do later.
Right.
Yeah, okay. All right, I'm going to have, well, what we always do at this point, we're just going to do it. We're going to have everybody stand up, turn and face your neighbor on the right. For those of you who are new, you want to enjoy this experience, just go with the flow. You can put your hands on. So grab the shoulders and squeeze. This is the massage time. Sometimes you do this toward the end just to wake you up, but this will be good. All right, karate chop. Do a karate chop. This is how you love your neighbor. All right. Okay, turn around and love your other neighbor. Get that stress out. That's good. All right, karate chop. So mainly we're doing this just to make sure nobody goes to sleep. That's my angle on that. All right, good. Give yourself a round of applause. And heads up, guys. We got a couple of t-shirts coming out. Heads up. Whoa. Hey, nice. Good job. All right, excellent. Okay, so now we go into the next part, which is the solution. How do we reverse diabetes? All right, so you probably could have guessed this. Kill the what? Kill the carbs. Now, all the carbs that you see down here, some of them may be suspecting, unsuspecting. You know, you probably could have guessed bread and potatoes and pasta. Those are all no-nos. But you may not know that we live in a day and age where you must read the labels so you're not kidding yourself. And when you read the labels on things like ketchup or juice, you'll be shocked to see high fructose corn syrup. And it goes well beyond that. It's in so many products, tomato sauces, all types of things that you would think are healthy, and they're not. Just read the label, and you'll get confirmation on what I'm saying. What about orange juice? What's wrong with orange juice?
Sugar.
Yeah, and it may not have high fructose corn syrup, but it's got lots of fructose. Yeah, so if you have a glass of orange juice, is that like one orange that it took to squeeze in there? Like 8 or 9? Now, if you sat down and ate 8 or 9 oranges, I mean, that's a dose that's poisonous, right or right? So this is where I want our understanding to come in to where we can make little changes. When we're pulling out these foods, now you're actually going to think about what you're eating, and you're going to think about the effect that it has on your liver, your glucose, your insulin, and your overall health, and where your brain is going to be 10 years from now, right or right? Yeah. So we look at this, and then you see the big thing of fruit there. Nothing wrong with that if you just have a small serving, a couple of ounces, but don't sit there and eat the whole thing. Go, endless on it. Then what do you see there? You see beers or cocktail or, rum, whiskey. All of that is getting metabolized the same way that fructose does, right? Like a heat-seeking missile right to the liver. And what is it doing? Just the alcohol, the fructose, what is it making? It's turning your liver into a fat-storing machine. And it doesn't matter how many supplements that you take or how much exercise that you do or how much metformin that you take, the damage is being done. And it's only till we start implementing all of the pieces of the puzzle to where we really start reversing the disease. You have a bowl of Cheerios there. I often talk about how heart healthy it is, the marketing that they do there, like the cholesterol that it reduces, which, who cares about that? If you come to our Heart Smart Nutrition Workshop, you realize that lowering your cholesterol doesn't prevent heart attacks. So what could this eating Cheerios do? It's greens. We don't want that. No, stop. Okay, so remember that awful cycle I talked to you about before? When we kill the carbs, we're stopping that whole thing dead in its tracks. We're reversing that cycle. Remember what I said? We're reversing it. If you take away the high carbohydrates, you're taking away the high glucose. If you take away the high glucose, you're taking away the high insulin. If you take away the high insulin, you're taking away and you're correcting the cause of insulin resistance. If you take that away, the liver will start to burn the fat instead of storing it, right? And so you're literally undoing that cycle, reversing your insulin levels, immediately starts reducing and reversing fatty liver, obesity. Your body just starts burning fat. It starts letting go of the weight. It's not like you have to try to do it. There's no need for it. The body lets it go. Heart disease, cancer, Alzheimer's, vision loss, all the terrible aspects of diabetes are wiped away with one simple thing, killing the carbs, right? So one more time. When glucose goes up, what has to go up to get the sugar into the cells? Insulin. What do we say happens when insulin goes up? It drives fat accumulation. In the liver, cells get overstuffed in the liver. The cells all across your body, even skeletal muscle cells, become overstuffed. They start spilling over, and that's where the insulin resistance is. And again, your body just keeps storing fat. But you want the opposite of that. You don't want fat storage, you want fat burning. You see that little fat word on fire there? And what's the key there? To keep our what down? To keep our, which hormone? Starts with an I, sounds like insulin. To keep our insulin down, right? And what do we need to do to keep our insulin down? It's right. So now you're getting this. This is how we need to think. It's not about losing weight. It's about understanding how foods affect your health. That's what it is. And you have to think like a chemist, or like you have to use your intelligence to make good decisions. And when you do, it's like fine-tuning the dial on a radio, Rosita. It's like bringing it into fine-tune, and then your body is like firing on all cylinders. The more you understand, the better the results are going to be. I really try to not get too geeky with all the science and stuff like that, but there's a part of it that really needs to be reviewed so that you understand the depth of it, right? And those are the layers that we need to do. So if you watch that green line right there, that's somebody who's having foods with a low glycemic index. That's somebody who's eating a nutritional diet that doesn't spike insulin, that doesn't have a reaction of glucose going up. So you can choose foods that keep your insulin levels stable all day, and you know what that does? It takes your body from fat storing to fat burning. Raise your hand if you want to be a fat burner. Say aye. Yes. And that's what you have to do. You just have to eat foods like that are low in sugar. So how many of you guys like a good steak every once in a while? You know, listen, does Dr. Yachter cheat? Do I eat grain-fed meat? Yeah, like if we go to a local steakhouse and I'm not cooking it and I'm not buying the meat, yeah, I'll have one of those every once in a while, like Longhorns. So here's the deal. I don't do it that often, but whenever we buy meat, like if we go to Publix or Fresh Market, we always get the organic. We always get the grass-fed. But if you look at the difference in those meats, in the muscle, that's what you're looking at there. In the grain-fed, all the marbling, you know what that's called? Lipogenesis. That's called lipogenesis. That's an animal that was just literally producing fat. They just wanted to pump those animals with as much grain and corn and make them fat-storing machines. And that's the difference. That's what we love. We love all that marbling. But you see the difference with the grass-fed, completely different. So whether it's a human or a farm animal, it makes no difference. If there's body chemistry, if there's a liver, it's going to do the same exact thing in the presence of carbohydrates like that. Okay, so what's the cause for all this? Well, going back into the 90s, there was this political struggle with who was the smartest person. There was this guy by the name of Keyes, and he pulled the wool over the eyes of this political group of people, and he got away with it. He wrote a paper, he got it accepted, and it was totally wrong. And they said that fat was bad, and that we should be taking all the fat out of our diet, and instead we should replace it with calories from carbohydrates. And somehow they knew it was wrong at the time, But somehow they were able to get it passed, and they got it through the USDA, and they got it into all the schools, and it ruined our health. It ruined, for generations to come, it ruined our health because of politics. And it's being recognized now as a mistake, and they're trying to correct it, but look at the habits that it's created. And this was the food pyramid that was instituted just within a short decade. They saw the number of cases of diabetes double just from that, because they said this, the biggest portion of our diet should be what? Breads, rice, pasta, cereal, everything that you could possibly do to raise your insulin levels and cause fatty liver and cause obesity and cause diabetes and all the things that we're highly medicated for today. Right? It's amazing, isn't it? It's sad. So they're starting to realize it now, but it's taking way too long. And that's why we do these classes, and that's why we share on Facebook Live, and we send you the link so that you can pass it on to your friends and family, because it's science. And what we thought before and what we believed was junk science. It was political science, for lack of a better term. So the real food pyramid, to apply this, is what you see on the right side, which the base of the foundation is not carbohydrates, it's not grains, it's not bread, rice, pasta, cereal. What do you see there? What is it? Meats and fats. Yeah, that's the base of it. And greens, so you can see that right there at the base. Extra virgin olive oil, coconut oil, seeds, all your greens, your beef, pork, chicken. Again, as long as it's grass-fed, if it's organic, and you're having a variety, then this is the right food pyramid that we should be gravitating to. You see dairy in there, which some people are okay with it. Some people have an allergy to it. Everybody's different. But again, we want to have grass-fed dairy. You have fish, you got eggs, you got your low-sugar fruits and vegetables, and even cacao, which is 90-95% dark chocolate, has health benefits also. Make sure you got lots of good fats in there. Lots of good fats. The more fats, the better, for your brain, for your blood sugar, for your heart, for your eyes, for your skin. Can't get enough good fats, and it is, and the more good fats you have, the more fat you will burn. All right. So, just some examples here, so you can see. This is actually a snapshot of my kitchen counter, my breakfast. I have my Ultraplex shake in the morning, and a scoop of almond butter, and I mix some berries with that, and then I'm in the shower and in the office in literally 15 minutes. That's why I like it. It saves me a lot of time, and I check all the boxes with that. You don't see any complex carbs there. You don't see oatmeal. You don't see grits. You don't see toast, Pop-Tarts, croissants, right? None of that stuff. If you want bagels, yeah. So you see the eggs there. You can see a stir fry. This is what we had last night for dinner. I try to cook on the weekends. It was one of my goals to do that, and just try to be a blessing to my wife and my family. So I bought a pellet smoker grill, and so I'm out there Saturdays, and then we eat the leftovers on Sunday, and then and again we always get grass-fed stuff, and then Sunday night I'll make eggs. I'll make scrambled eggs, and we'll have these chicken sausages by Applegate. It's organic, and I'll chop that up in there. And then last night we had broccoli, and that's it. Very low carb, very low glycemic index. Go to sleep, wake up the next day, stomach's flat, my belt buckle is right where it's supposed to be. I'm a happy camper. I don't know about you, but that's the way I like to feel. I don't like when I wake up. I get my belt is tight, my stomach it's uncomfortable, and you know what? I don't have fat pants. I make myself suffer because I will not go to the next size waist. I have the same pants, the same waist size I have for the last 30 years, 35, 40 years. I won't change. I won't get other pants. I won't have a fat wardrobe to ease into and make myself feel better. No, I make sure I pay the price. I'm accountable to myself. I don't know if that resonates with anybody, but that's my problem. But just sharing with you, breakfast here, you see avocados, you see zucchini, lunch. What do you see? You see salads, right? You see salads with a piece of protein, a piece of fish, and you can, a Greek salad. The most important thing that you can have for lunch, for dinner, on your salads, on your vegetables, is what? Extra virgin olive oil. Yes, you got to keep that with you. And then for dinner, what do you see? Lamb, broccolini. Here you have a chicken breast, and you have some string beans, and there you have a stir fry. But what do you not see there? No rice. No rice, no bread, no potatoes. Okay, so now if you're diabetic or you're overweight or you have health conditions and you're looking to see like good results fast, this is how you should be eating all the time. Can you have a cheat day? Yeah. I don't say have a cheat day. I say have a cheat meal. Right, Carlos? If you wanna meet me for lunch and we go over to Vito's and we get 2 slices of pizza and a salad, I'm just doing that Friday for lunch. That's it. Or we'll go to Carlos and Pepe's and I'll have my arroz con pollo or the pollo a la plancha, right? And that's it. I'm just doing that because if I do that again for dinner or I do it the following day, I'm toast. My belt doesn't feel so good on Monday. So I'm just telling you what reality is, that you have the same number of fat cells that you were born with, and those things are either blown up and overstuffed or they're shrunken down and under control. It all depends on your insulin. It all depends on what you're doing with those insulin levels. And who's in control of that? You are. Yep, exactly. So getting back to the complete clean, this is one of the easiest things. If you're just getting started with this, I've had patients attend my workshops and tell me three months later that this is all they did was change their breakfast and they had a shake instead of their regular breakfast. And just by doing that, literally lost 10, 15. One guy said he lost 20 pounds. So this is an easy way to make application with what we're talking about. Very low glycemic index, good amount of protein, like 26 grams of protein. But that's not the only reason why I do it. The other reason why I do it is a full spectrum of multivitamins, all the vitamins that you need, and also antioxidants. It also has gut support, probiotics in there. It also has anti-inflammatory support, curcumin. The other thing that it does is it supports phase 2 liver detox. The last thing that you want is adding insult to injury to what we're talking about, fatty liver, is to have toxicity in your body and a toxic liver. So this has something called N-acetylcysteine, which actually boosts glutathione, which is the body's major antioxidant, and it gives you a low-level daily detox support also. And in the end, what is this all doing for your insulin levels? What is it doing? It's stabilizing. It's helping you start your day in fat burning. It's up to you to keep it in fat burning, right? So other supplements, many of you are in here, and I know you've been taking this for years because it works. And I haven't changed anything. I'm just going to review with you the 3 most significant supplements that you could take to stabilize your blood sugar and help you if you are trying to reduce and get off diabetes medications or just to maintain healthy blood glucose levels. Ultraplex glucose will help you do that, helps to support healthy glucose metabolism and insulin sensitivity. Berberine is just as effective, if not more effective, than the drug metformin. So this is a big one. And we've had this many patients, I mean hundreds of patients on this for years. It's the real deal when it comes to stabilizing your blood sugar. Alpha lipoic acid is for whole body glucose utilization, not just your liver and the cells, but also the skeletal muscular cells as well. And it's an antioxidant also. So with these supplements, again, the only time we ever discount the supplements are the nights of the workshop. And the quantities are limited, but it's up to you to take advantage of this. We only discount on the nights of the supplement because we know that you're here because you want to learn. And information is one thing, but information without application is what? Hallucination. I don't expect anybody to hallucinate. I expect that you're here because you want to get well, and you need to take the steps of implementing this. And if you have blood sugar issues, then don't walk out the door without having a plan. I would recommend that this be part of your plan for sure. So is exercise important? Yeah, especially after Thanksgiving, and you just overstuff yourself to the point where you can't breathe. Ask me how I know. I did this last year. I pushed myself away, and it took me a while to actually straighten up because my gut was so full. So I went for a walk, and that helps with digestion for sure. But when it comes to weight loss, there was a study recently. They showed 107 obese individuals, 65 and older. They did this study over a 1-year period. And here's what they found. It was very interesting. There were 3 groups. There was one group that just lost weight. There was another group that lost weight and exercised. And there was another group who just exercised. So there were 3 different groups. How many groups? 3 groups. So what did they find? The weight loss only group, their insulin sensitivity improved by 70%. If they lost weight and exercised, their insulin sensitivity improved by 86%. If they exercised but did not lose weight, what kind of improvement did they see? Nothing. So what is the single greatest factor that will impact your insulin sensitivity, your insulin levels? Losing weight, yeah. You know what they found with bariatric surgeries? People reverse diabetes just like that. Bariatric surgery. It works. I mean, substantiated in medical publications. But it's surgery, so you know that comes with complications, right? What else? They know that it happens with fasting. Within 24 hours, if you fast, your body is dumping glycogen, and then it starts metabolizing fat. Same thing with low-calorie diets. Same exact thing. So this is how we go about it. If we're not paying attention, these problems sneak up on us. At least as little as 5 pounds. This is the first detectable abnormality, they said, relating to hyperinsulinemia and insulin resistance. After that, just gaining as little as 5 pounds. After that, you start working on fatty liver, high blood pressure, and high triglycerides. The last symptom to rear its ugly head is what? The high glucose. Yeah, and then the type 2 diabetes. But where does it start? With only a little bit of weight gain, just 5 pounds, let alone 10, 15, 20 pounds. So we need to look very carefully at this. Now, many of you know we have a program in our office that helps to correct the metabolism. And I've talked about this, but tonight there's one very specific aspect that you need to understand why what we look at is important. You see that right there? It says visceral fat rating. What is the visceral fat rating? How much fat you have around your organs, right? Your liver, what else? Your gallbladder, your heart, all of those abdominal organs, which because of something called lipogenesis, because of too much sugar, now your body's depositing fat around that and suffocating those organs. Everybody knows how deadly fatty liver disease is, right? We know about diabetes, but remember the diabetic diagnosis comes last. If you could diagnose the trend that you're moving in that direction, what would be one of the most important things that you could look at right now? Your fatty liver, yeah, or your visceral fat rating. Another thing is your body fat percentage. If you stood on this body mass index scale that we have, and it comes up and it shows that your body mass is 45% fat, isn't that speaking loudly about something? Isn't that showing you the trend in terms of where, forget about the fact of being overweight, or on the other hand, maybe you're not overweight. You may be in normal range with your weight, but your visceral fat could be way out of range. Why is that? It could be a fructose issue, it could be an alcohol issue, it could be a number of different issues. You could have fatty liver disease even though your weight is within normal range. Do you see how important this test is? This is why I'm discussing this now, and the only way to know is when you stand on that scale, it puts a low-level electrical impulse through your body, and there's an algorithm based on the resistance, the different masses of tissue, the water, the muscle, the fat, they all have different levels of resistance. And this is how the body is calculated based on all that breaking down. What else is important? Your body mass index, right? Okay. So, again, as a tool to decipher where you're at in terms of your liver health, your blood sugar, whether or not you're trending in the direction of dementia, Alzheimer's, all these things that we talked about tonight, an easy way to know this is to have a body composition analysis. So if your body composition analysis shows that there are problems, what would a smart person want to know after that? What can I do about it, right? We don't want it to get worse. We want it to get better. What is the plan to do that? What's the plan to get your visceral fat in normal range? What's the plan to get your body fat down? What's the plan to increase muscle mass? What's the plan to correct your metabolism? Maybe you may be 50 or 60 years old, but if your metabolic age is 90, what is that telling you? Your whole system is crashed. And until you get those numbers dialed in, it doesn't matter how much weight you lose. Anybody can lose 10 pounds. It's not difficult to do, but that's not getting to the core of reversing the disease that potentially could be developing, right? So that's why this is important. Now, our system, we've seen great results with this. Matter of fact, I've got some people here tonight that I want to recognize. Farheen, can you come up for a second? Arsenio, can you come up for a second? I don't want to make a big deal out of this. I know you guys are tired, but we're excited. Okay, come on over. Okay, so this is Farheen. I wrote everything down here. Farheen has lost 27.4 pounds, and this was in five or 6 weeks, right? 5 weeks.
Well, yeah.
Okay.
4 days.
Okay. I don't know if you remember, but your BMI came down 4.5 points. And your visceral fat came down 2 points. Yep, so big change there. Not just the weight. Arsenio lost 16.5 pounds, really over 20, but he got sent away by work, crashed the party, messed up his program. So an official 16.4, but your visceral visceral fat came down 3 whole points, and your BMI came down 3.5 points. So again, I'm excited for the weight loss. I know you guys feel better. You have a lot more energy. You're sleeping better. They can't say enough about how much they feel and how much they've accomplished. But the real proof is in the numbers. The visceral fat, the BMI, and all of the health benefits that you're not just enjoying now, but think about a year from now, 5 years from now, 10 years from now. All the doctor's visits you won't be having. All the medication you won't be having. All the time that you'll be enjoying when you're retired, taking trips with your family because you're healthy. So kudos to you guys. Thank you. Hey, wait. We got some medals for you too. All right. Because you are champions. Yes, you are. All right. I love and appreciate you guys so much. Thank you for being bold enough to come up and share with us. Thank you. Everybody give them a hand up again. Okay. So that's just an example of what I've been talking about, so that you can see what's possible and what the reality is. And we've put over 2,200 people through this program. A lot of people do it because they just want to lose weight, fit into their bikini for the summer. If you want to do that, that's fine. We'll help you do that. But we're talking about reversing disease. We're talking about reversing fatty liver disease, correcting your metabolism. There's a food plan that we have. There's a manual. There's a journal. There's follow-up weigh-ins. We hold your hands. It's fail-safe. If you do exactly what we show you to do, dot the I's, cross the T's, you don't cheat, you will see these changes. Your BMI comes down, your body fat comes down, you lose at least 15 pounds, or we put you through a second program at our expense. So if you're interested in this, again, it's guaranteed. Ask Deborah or Tamara at the end of tonight, and they will get you scheduled for your body composition analysis. You'll stand on the scale, they'll go over everything with you, they'll review your health goals, and see if you're a candidate for the program. And if you are, they'll give you all the details as far as from there. Okay, so that's all I wanted to say about that. Finishing up with, so there's the body composition analysis, normally 99, it's only 27 if you make the appointment tonight. So that's for that appointment. All right, last thing I want to finish up with. What does chiropractic have to do with your blood sugar? Does anybody know? What does chiropractic have to do with your blood sugar? Well, see that lady down in the corner there? Her name is Georgia Reimers. Georgia was a patient in 2001, and she came in, and she was bent over like this. She's like, Dr. Yachter, my back is killing me. Can you help me? Right here, right here. Like where? Right here. She was bent over like this. She was in so much pain. I said, okay, well, come on in. Let's sit down. And I got her history. I sat down. I did an exam on her. And what I found, what was causing her pain was in the middle of her back. This thing right here. It's called subluxation. Not a subway station. Subluxation. What is that? It's the bone out of alignment putting pressure on the nerve. And the pressure on the nerve was causing her back to hurt. So I said, okay, I think I found the cause. Come on over here. So I laid her down on the table. And very, very gently I started pushing. And I felt the bones move. I felt them move. I said, whoa, that's good. That's good. I didn't expect that. Come and stand up. So she stands up off the table. She gets up off the table. And she stands straight up just like that. Oh, I didn't expect that. That's good. Now, when she stood up, I could see what I couldn't see before, and that was a pump on her belt. She had an insulin pump. So I said, oh, you're diabetic. How long have you been diabetic for? She said, 40 years. I said, why didn't you tell me? She's like, you didn't ask. I said, okay, well, come back tomorrow. I just want to check up on you, make sure you're doing okay. So she leaves. About an hour later, somebody runs in off the street, screaming at the top of their lungs, call an ambulance, call an ambulance. One of your patients is passed out in her car. Ran out there. And there's Georgia. She's slumped over the steering wheel. I'll never forget. Her foot was on the brake, and the transmission was in reverse. And she was still in the spot. She just passed out, like in that position. How she didn't roll back and have an accident, by the grace of God. I put it in park, ran inside, and called the ambulance, and I hung up, and I'm thinking to myself, well, you know, she's diabetic. Maybe it has something to do with her blood sugar. So I got some orange juice and I went outside and I started dabbing her lips. Sure enough, she started coming too. I'm like, thank goodness. Then the ambulance pulled up, took her away, and I walked back into the office and I'm thinking to myself, what the heck just happened? What did I do wrong? I just put this lady in the hospital. What could I have possibly done wrong? And I hardly slept that night. I was so anxious. I was so worried. Came in the office the next day. Went to go get her x-rays, started studying her x-rays. It was a long night. I'll never forget that morning. I saw the door fly open and Georgia pop her head in. And she's like this and she's smiling. And I'm like, thank goodness. She said, why? I said, because I thought I did something wrong, but I think I did something right. She's like, what are you talking about? I just want another adjustment. Can you adjust me? I said, didn't you go to the hospital? She said, yeah, I just came from the hospital. I haven't slept this good and felt this good in 40 years. I want another adjustment. I said, okay, come on over here. I've got to show you something first. And I took her over to the chart. You see the chart up there on that right side? You see how the nerves branch off and they go to all organs? Right in the middle, there are nerves that branch off and go to the stomach and the pancreas. I said, Georgia, you know, on your x-ray, that nerve is being pinched, causing your back to hurt. That's the same area where it's gone off to your stomach and your pancreas. And I think what happened was when I moved that bone and opened up the nerve channel, it took the pressure off the nerve and you were able to stand up and you felt better, your back pain went away. But I also opened up the nerve channel to the nerve taking the function to the pancreas. And I think your pancreas started regaining function, but your pump was still on, so you got too much. She said, that makes sense. Are you going to adjust me now or what? I said, yes, I'll adjust you. Got her adjusted, and she kept coming in. Weeks go by, do a progress evaluation. What happens? She says, Doc, I haven't had an ounce of pain, not a lick of pain. I'm still sleeping good, feeling good. But I wanted to let you know my endocrinologist reduced my insulin requirements. I used to be on 8 units, now I'm down to 5. I said, wow, good job. Keep up the good work. So a month later at her next progress evaluation, she tells me she's down to 3 units. She went from 8 units to 3 units. 5 months later, we were about to transition her down to maintenance. You know what she tells me? Dr. Yachter, that my endocrinologist has me eligible for a special study at the University of Miami. He has me down to 0.8 units. Never had a 67-year-old brittle diabetic go from 8 units to 0.8 units in 5 months. He wants to know what my clinical protocol is for reversing diabetes. That's what he wants to know. Would you be willing to share your clinical protocol with my endocrinologist on how to reduce diabetes? I said, sure. You know what it is? What? Tell me. Let me write it down. I move the bone, and God does the healing. Yeah. That's what it is. Because God put the most amazing healing power, the most amazing intelligence inside of your body when He made you, when He breathed life into you, when He gave you life. He made you. He knit you in your earthly mother's womb, right? That intelligence made your nervous system first. That intelligence made all the nerves in your spinal cord branch forth. That intelligence made those little buds at the end become organs. It made the heart, it made the lungs, it made the liver, it made the spleen. That intelligence is the same intelligence that created the living universe and hung the moon and the stars. That organization out there in the universe is the same organized intelligence inside of your body. Doesn't need any help, just needs no interference. What did Dr. Yachter do? What was my clinical protocol? To find and remove the interference to what was stopping her from functioning and healing the way God created her to heal. Does that make sense? Yes. And you know what? Beverly, the last time I adjusted you, guess what happened when I opened up that nerve channel? We removed the interference. And now you're functioning at your God-given potential. Right? Salon, I adjusted you today. You got your spine in line. We opened up the nerve channel. We removed the interference from the brain to the body. And you're functioning at 100%. Right? Who wants to be at 100% of their God-given potential? Everybody. So what's the source that you have to utilize and manage? That's which system? Your nervous system. That intelligence lives in your brain, right? That's why the guillotine proved that. Okay? So no brain, no life. You got it? So that intelligence has to make its way always from your brain down your spinal cord out through the nerves. Can you feel if a bone's out of alignment interfering with that nerve transmission? No. They found this at the University of Colorado. The weight of a dime on a spinal nerve. The weight of a dime. Edna, if I put a dime right here on your shoulder, you'd sit there comfortably all night. But if that was a nerve in your neck or your back, you'd be losing 60% of that nerve supply going out to that organ. Did you know that? When do you want to know? How long should you wait with that pressure on the nerve there before you get it fixed? Right? The longer it's there, the less correctable it is. The faster you get it fixed, the closer you'll be to your God-given best and the healthiest you can possibly be. You can eat good, you can exercise, you can take all the supplements till the cows come home. But if you've got this condition, how do you expect your body to assimilate those nutrients? How do you expect your brain to be able to coordinate the function of your lungs and your heart when you're exercising? If there's interference, you'll never be as healthy as you could possibly be. On planet Earth, we have 8 billion people. 8 billion people, right? How many of those people that are living have a nervous system? All of them. How many of those 8 billion people have a spinal cord and nerves? All of them. How many of them have a spine? What percentage would you think probably have some level of interference there? What percentage of them have health problems that could probably be helped and reversed if they were evaluated for interference to their nervous system? How simple this is, right? We all know people with different conditions, whether it's diabetes, whether it's asthma, sleeping problems, headaches, digestive issues, prostate issues, menstrual issues, mental issues, emotional issues. Good Lord. So many of them are just one adjustment away from having their best night's sleep ever, their body chemistry normalized, being happy, having peace, and starting a new life in the right direction. One adjustment away. Man, I wish I could be out there on a megaphone and the TV and really just wrap my arms around the world. But that's not me. I'm not God. I have hands that can move bones. I got a mouth. I'll do my part. I'm wondering, is there anybody here who's willing to do their part? Anybody willing to do their part? Yeah. And many of you have. And I appreciate that. And that's our mission field out there. That's it. We are the mission. We are the mission. We know the truth, and there's people out there that need to hear it. So I want to thank you for those of you who have made a point of making a difference. That means everything to me. That's why I'm still standing here after 30 years. I am retired. I do this because I love you and I love what I do. And I love the fact that there's potential to be released in people. And I love to watch the transformations unfold. Right, Emily? This is our purpose. You have a purpose too. Share it. Share your gift. Share your blessing. Now, if you're not a patient, you can have the opportunity to sit down with me and discuss what you would like to discuss with me, whatever it is. And to have a consultation, an examination, and sometimes even we need x-rays to look at the thermal scan and the x-rays and get a complete picture of your nervous system. Normally that's about $360. If you get a friends and family coupon, it's a health pass. Some of you have seen that before. It's only $97. So that's an amazing gift that you can give to yourself or a family member or a friend. Even if they're not here, if you're thinking of somebody, ask them up front for one of those family and friends certificates, only $97, to have a consultation with me, an examination to see what the status of your spine and nerve system looks like. And if there's any work that needs to be done, or if you have a particular health complaint that you want to get to the bottom of, the cause of, that's what you use that for, that first day where we sit down and get to know each other. All right, so if you're a guest here, on behalf of the person that invited you tonight, I want to encourage you to do that. If you have a family member or anybody else who's not here, you can use that as well for that. So, all right, before we leave tonight, make sure action steps. Remember, action. Information without application is hallucination. Very good. Thank you, guys. You're getting it. You're getting it. All right, so let's apply what we learned. The supplements are available, limited supplies, so get what you can while they're available. For those of you who want to have a body composition analysis, make your appointment for that. For those of your guests, if you want to make an appointment to schedule with me, you can do that as well. I love and appreciate you. Thank you so much for being here tonight, guys. God bless.